I think the chronic pain takes a toll on you emotionally when you don't realize it until it's over.
Well, the worst thought I had was that's the way I was just going to be the rest of my life, is dealing with it and just having to, try and go through it.
To me, the pain just became a part of my life. I just try to block it out and keep going.
The people you just met have a few things in common. One, they're baby boomers, kids of the 40s, 50s, and 60s. Second, they enjoy a busy, active lifestyle. Third, they've all recovered from a time in their life when debilitating pain threatened their bodies and minds. However, they each chose to do something about it. They turned to physicians at the Methodist Hospital system for help. Tonight, you'll learn how physicians at the Methodist Neurological Institute are using advanced treatment methods to help patients with debilitating pain. You'll also see how joint replacement surgery is allowing active baby boomers to get back on their feet again. And we'll tell you about an opportunity to meet some of the doctors you'll see on tonight's show and learn how you can stop living in pain. I'm Grace Carter. Welcome to this edition of Leading Medicine. More than 75 million adults in the U.S. live in pain. In fact, chronic pain affects more people than other debilitating diseases like diabetes, cancer, and heart disease.
Some of the patients, their pain is so bad they're completely incapacitated. This is one end of the spectrum, obviously.
Dr. Richard Simpson is a neurosurgeon at the Methodist Neurological Institute.
Obviously, we have all kinds of patients in the middle, some that can be treated very simply with medications. But there are a number of patients that the traditional medical management just fails to satisfy their pain.
I have disc degenerative disease, deterioration of the spine.
Eunice Kinsey had 2 major surgeries at another hospital to help strengthen her fragile spine. The procedures were successful, but she was left with chronic back pain, which had a debilitating effect on her mentally and physically. So she turned to Methodist.
The pain medication, I really don't like taking it. The pain just became a part of my life. I just try to block it out and keep going. I was very withdrawn. I stopped going around my friends.
I perform interventions for pain. I'm not a medical pain specialist per se, but I do interventional surgical pain management. And what this entails in general are implantable therapies. The 2 most common implantable therapies are an electrical stimulating device that's placed into the spine, and another one is called an intrathecal drug delivery device, and it delivers medication to the spinal fluid.
Eunice was a candidate for a pain management option called neurostimulation. A small generator is implanted in the lower back or stomach area. The generator sends pulses through thin wires next to the spinal column. They intercept pain signals before they reach the brain. The patient uses a handheld remote that adjusts the level of spinal stimulation needed. After a brief trial phase, Eunice decided to have the device permanently implanted.
And everybody that saw me, they asked me what was wrong, that I looked so different. I had this smile and gleam or whatever. I told them I had a brand new friend. They thought I was talking about a man. But I was talking about my implant.
Well, they make a tremendous amount of difference in patients' life. A lot of times the patients can get back to employment. Certainly their pain's relieved to the point where they can do so. Their activities of daily living are dramatically improved. Their family dynamics are improved. Their future outlooks and their attitudes are improved. And so we find these therapies to be quite successful in not just treating the pain, but also treating the entire individual.
Dr. Pankaj Satija, a neurologist with the Methodist Neurological Institute, says chronic pain can now be defined as a disease itself.
These people live with pain when they open up their eyes in the morning until they go to bed at night. They live in pain all day long. Some of them have good coping mechanisms and they're able to, smile, they're able to function around the house. That does not mean that they're not hurting. They continue to hurt, but they learn to live with it.
For more than a year, Patricia Reese suffered with fibromyalgia, a common syndrome that causes pain and tenderness in the joints, muscles, tendons, and other soft tissues.
Tingling, sometimes burning feelings, discomfort in moving ahead, shoulders, even arms sometimes. Even the legs would feel tingly.
Miss Reese had, when she came to me the first time, she had several complaints, of which two major complaints were severe back pain, which radiated into her legs. She had a lot of difficulty walking. She couldn't walk more than a few steps before she having to stop and take rest. She had stopped going to the grocery store. She had stopped going to birthday parties, to social events, and she was at home suffering from this bad back pain and leg pain. The other component of her pain was this overall body fatigue.
It happens so often, every day, for a long time, that you're not screaming with pain. But with it coming every single day, it is terribly, terribly, terribly discomfortable, uncomfortable, and also very much hurts your morale.
We also landed up doing a set of nerve injections in her lower back, and Ms. Reese has bounced back beautifully. Today she complains of no bodily pain, no back pain, no leg pain. She's gotten her life back. She's very happy. She's able to do everything she couldn't do earlier. She's able to socialize. She was able to go and get a nice haircut today and dress up for the show. We're very, very pleased with her results.
Studies indicate that a third of the people who report living in pain describe their pain as disabling.
My advice to these patients is to not accept any pain as normal, to not accept that they have to live with wear and tear of the body, they have to live with this pain on a regular basis.
Methodist is hosting a free pain management seminar on Wednesday, June 13th. To register, call now at 713-790-3333. Leading Medicine will return in just a moment.
Joint and chronic pain is the #1 reason patients visit the doctor. Attend a free seminar Wednesday, June 13th, and learn how you can stop living in pain. At this seminar, you'll hear from physicians about the latest procedures in chronic pain management and joint replacement surgery so that you can keep moving. To register, call us now at 713-790-3333. It's time you stopped living in pain.
Being a leader takes preparation, it takes perseverance, it takes execution. When I hurt my shoulder, I turned to a leader. From treatment to recovery, Methodist takes care of the complete athlete, amateur and professional. Their job is to make you faster, better, stronger, your best.
Methodist, leading medicine, ranked #1 in Houston.
Are you suffering from neck and back pain? Attend a free seminar Thursday, June 14th at Methodist Willowbrook Hospital to learn about various conditions and treatment options for back and neck pain. To register, call us now at 713-790-3333.
Welcome back to Leading Medicine. I'm Grace Carter. Tonight's show is about something that most of us have experienced at one time or another, living with pain. If you've experienced long-term pain from an injury or illness, the toll it takes on the mind and body can be difficult.
There is nothing heavy about tap. Tap is always fun. I like to bring joy to people, and tap is always joyful. I say you cannot tap dance without a smile.
But there was a time in Mary Lee's life where smiling didn't come quite as easy.
I had a trauma-induced injury in the early 90s with a fall. I was on the ice at a museum in Oslo, Norway on a fabulous vacation, and I just slipped. My first surgery was in 2008, so I imagine I really became incapacitated around 2006. It was very gradual, but at one point I was in a hover round right before my surgery.
Her first hip replacement surgery brought her some relief, but within 2 years, her other hip started to bother her. Dr. Stephen Incavo is an orthopedic surgeon with the Methodist Bone and Joint Center located at the Methodist Hospital.
We are seeing more joint replacements, and that's primarily a demographic issue. people are aging. We all know that the baby boomers are now getting to about 65 years old. So the 55 to 65-year-old age group is increasing, and that's where most of the arthritic patients are. Another reason is more people have participated in sports in the last 25 years than had previously, and those injuries now are adding to the problem.
It was a shooting pain all the way down my leg, from my hip to my knee. And when it got to the point that even at night I couldn't sleep, I was getting so I walk with a limp, and then I got so I could barely walk. It's a frightening thing to think someone's going to replace your hip, so unfortunately I put it off.
Dr. Incavos says people suffering with joint pain should think about 3 general guidelines when considering joint replacement surgery.
One is when you can't walk around the block without pain. 2, if you can't sleep at night, because that's a tough way to start every day if you're tired and in pain. And the 3rd is if you're just tired of living with the amount of pain that you're having.
It's a very serious thing to consider, but considering the alternative, I would not have it any other way.
According to Dr. Ken Mathis, chairman of the Department of Orthopedic Surgery at the Methodist Hospital, 63 million Americans suffer from chronic joint pain, and the large number of active baby boomers will increase the demand for joint replacement surgery.
When I was a kid, I remember watching Neil Armstrong walk on the moon with my great-grandfather, who was crippled with a bad hip. We had nuclear missiles, nuclear submarines, men walking on the moon, and we couldn't fix his hip. So in my lifetime, I've seen something that has brought millions of people the ability to live without pain and walk and live independently and take care of themselves.
Mike Glazner has spent most of his life on his feet, whether it's in the church pulpit or outside on the track.
I've exercised my whole life. I was a runner in high school, and when I got out of high school, I began to enter cross-country races and road races all through the 70s and 80s, and then I've started walking, more recently as I've gotten older. I'm 58 years old, and so I've had to, just scale back, and I might walk 5-7 miles, at a time, 5 or 6 days a week.
About 12 years ago, Mike began having joint pain in his hips and knees.
It was just a constant aching whenever I would move, especially with my hip. With your knee, I think I could just favor it and not make it hurt as much. But with the hip, it was a constant pain that I had for months. And I'm taking Advil. I'm taking 9 Advil a day, 3 in the morning, 3 at lunch, and 3 at night. And, just to relieve the pain, to be able to function, in life as a husband and a father and a pastor.
Dr. Kevin Horn is an orthopedic surgeon at San Jacinto Methodist Hospital in Baytown. He performed Mike's hip replacement surgery last year. He says that even though most of his patients aren't walking 2,500 miles a year, he couldn't be happier to see Mike back on his feet.
He's more active than we've told him he should be, but he's able to stay very active as a result of his hip replacement. It's a man-made hip. It's good. It will keep you up, keep you walking, and take care of most of your pain. But it is what we call a salvage operation. And certainly there's people on the extreme like Mr. Glazner, who's a great patient and has exceeded all our expectations, but that's not the norm. The average patient just wants to walk without pain, something that he wouldn't have been able to do, of course, if it weren't for the advances in orthopedic joint replacement.
The Methodist Bone and Joint Center takes a comprehensive approach to joint replacement. Dr. Mathis says advances in joint replacement are helping patients get back on their feet quicker and with less pain.
I'm not going to say it's easy, but I can say it's easier, dramatically easier, significantly shorter hospital stays, and a few things all put together make this easier, but it's not easy.
The improvement in pain management following surgery is making joint replacement easier. Instead of giving medication after pain has started, medication is also given to help block the pain before the patient actually feels it.
And so patients actually are recovering a little faster in the hospital because they don't hurt as much, they're not nauseated, they're going home a little bit sooner, they're able to do more. It's a dramatic improvement over what we had before.
Other improvements include the use of better fitting implants for knee joints.
Our implants are better, our technologies are better. Our expectations of our patients have gone up, but so too have the patient's expectations.
Dr. Lionberger explains that one size knee joint doesn't necessarily fit all types of knees.
The development of knee systems have gone through an evolution that's probably one of the most fascinating. They went through a phase where we thought of women's and men's knees, and that sounded pretty good. And then we started looking at different peoples from the different worlds, and a Native American may not be the same as an African American, or a Asian isn't going to look genotypically, phenotypically the same, rightfully so, nor do their bone structures. And so now what implants are doing is trying to generalize these or specify size dimensions to more appropriate the size of the person.
95% of joint replacement patients report positive outcomes following surgery. One of the keys to a successful recovery is effective physical rehabilitation.
I think with our improvement in pain control, it's allowed us to speed up the rehab.
Dr. Carl Hicks, an orthopedic surgeon at Methodist Sugar Land Hospital, says rehab starts immediately.
The first post-operative day, they're going to sit up on the side of the bed so they start to get used to being upright. Again, because of those pain control things we can do that now. And the first post-operative day, they're going to be out of bed in a chair and starting to walk. No, they're not going to be running up and down the hallway, but they're going to be out of bed walking.
Orthopedic services are provided at all Methodist Hospital locations.
We can provide everything here from a joint replacement standpoint that can be provided anywhere else in the country.
Methodist has been the anchor and has really provided the resources that were necessary for us to provide such a comprehensive program.
For a physician referral or appointment, call Methodist now at 713-790-3333.
I did not realize the way pain drains you. Long-term pain drains you physically and emotionally, as we discussed. And once that's gone, you feel like it's a new start. It's a whole new life again.
Coming up, you'll meet John Garrett, living proof that 65 is the new 55. We'll return with more Leading Medicine in just a moment.
Are you suffering from neck and back pain? Attend a free seminar Thursday, June 14th at Methodist Willowbrook Hospital to learn about various conditions and treatment options for back and neck pain. To register, call us now at 713-790-3333.
Ballet is demanding on the body and the bones. As a dancer, I had to overcome many injuries. Fortunately, the Houston Ballet relies on Methodist. Now, I love teaching as much as I love performing, and Methodist is still there, helping to keep me moving and doing what I love.
Methodist, leading medicine, ranked #1 in Houston.
I guess if you're living with the everyday pain, the first thing is to try and find out why. Find out what the treatments are and if there's anything can be done. And if there's anything can be done and they can do it, then you certainly want to do it to take advantage of the time that you have in this life.
John Garrett has reached a milestone. He's back at the gym, pain-free, and carefully returning to his active lifestyle. He suffered from low back pain, the most common form of pain according to the National Institutes of Health. Dr. Rob Parrish with the Methodist Neurological Institute says about 80% of his patients complain about back pain.
Well, the most common problem we see are changes that are caused by just spine degeneration. The very active runner, the person who exercises compulsively to stay out of the doctor's office, wears their back out and ends up going to their primary care doctor more than once, and finally, because of persistent back and leg pain, ends up in my office.
The first things that manifested itself is I was having problems in my hips. I would have pain in here. After that, and over the years, I would start having cramps in my legs, and then I would start having pain and numbness in the bottom of my feet. And that gradually got worse and worse until about 2 years ago, it was pretty much constant pain in my legs, and I was just dealing with it and living with it. Last year, it became to the point where I was having problems walking for any length of time, I would have problems standing. By the end of last year, I could really only walk maybe 100 yards without really having to sit down. I could stand for no longer than 5 minutes at a time. I had some MRIs done, and the MRIs came back and showed that my real problem was in the spinal column, where the nerves were pinched in the L3, L4, L5 area in my spine.
Many of the patients I see are very active, athletic folks who have reached some event in life where the L4-5 disc has degenerated and collapsed, so it's pinching the nerves, and we have to do something to relieve that. He was in a tremendous amount of pain. He had pain in his back with almost any movement, and pain going down both legs, quite severe, because he was slipping. And as the spine slips, it pinches all of those nerves. He had had a number of conservative measures done up to that point. He was truly unstable in his spine.
John received a spinal fusion, a surgical procedure that joins two or more vertebrae together and eliminates motion between them.
One of the big advances in spinal fusions has been instrumentation. In the last few years, very few years, we've been trying to come up with better methods and better hardware to use in treating spinal diseases. And one of those has been the advent of a clamp that clamps the spinous processes back. The surgical time is shorter, the hospital stay is shorter, blood loss is less, and it does a pretty good job of keeping the spine from moving until he can grow together. You know, that's the whole point of a fusion, is to get one segment of the spine to grow together with an adjacent segment.
As soon as I came out of surgery, the pain was gone. There was no problems with cramps. There was no problem with numbness in the feet. All of that was gone. It was like a light switch that was turned off there. I knew the next day that it had been a success. So I'm very thankful for that.
The problems of aging of the spine or degenerative changes of the spine are usually something that comes on over a long period of time. And the spine is just like the other joints in our body, like our hip joint or our knee joint. There's a certain amount of use that you can get out of that joint, just like people whose knee or hip has started to degenerate. And once that gets to a certain point, it causes so much pain and disability that patients become ready to seek treatment.
The best exercise for the spine is walking. Walking is almost magical in terms of spine health. So that and keeping an ideal weight and doing good core exercises keeps the spine in its best health.
The Methodist Neurological Institute offers comprehensive patient services featuring a diverse team of medical experts, state-of-the-art facilities, and cutting-edge technology. Dr. Todd Trask says that neurosurgery has always had a very strong role in the care of spinal problems.
I think that neurosurgery, though, has been very strong in adapting some of the new technologies, like the intraoperative navigation. And so they've really been on the forefront of pushing some of these newer technologies in complex spinal problems.
I've been fortunate with the way that it's worked out. I really was in a lot of pain beforehand. I was just dealing with it. The pain is gone. Things are about as good as that I could have hoped for them.
Methodist is hosting a free pain management seminar on Wednesday, June 13th. To register, call now at 713-790-3333. Leading Medicine will continue in just a moment.
Joint and chronic pain is the #1 reason patients visit the doctor. Attend a free seminar Wednesday, June 13th, and learn how you can stop living in pain. At this seminar, you'll hear from physicians about the latest procedures in chronic pain management and joint replacement surgery so that you can keep moving. To register, call us now at 713-790-3333. It's time you stopped living in pain.
Welcome back to Leading Medicine. Tonight you've met some remarkable people, each one of them living with daily pain that affected their bodies and minds. With the help of physicians at Methodist, they're recovering and returning to the active lifestyles they deserve. After recent spinal fusion surgery, John Garrett is back at the gym, bench pressing 135 pounds.
The long-term goals would be to be able to be active, be able to get out and do things I want to enjoy the rest of my life without any problems, without any pain, without any limitations. And so, I feel blessed that that's what's happening.
Eunice Kinsey is busy in the kitchen again and getting ready for summer vacation with her family. A neurostimulator, what she calls her new best friend, helps her manage her back pain.
I started back going to the beauty shop. I had stopped completely going to the beauty shop. Yeah, because when I went to the beauty shop 2 weeks ago now, they thought someone was in after me because I walked in there so fast.
And hip replacement surgery helped Mike Glazner and Mary Lee Kennedy get back on their feet.
I can remember seeing on television years ago, one of the classic tap dancers, it could have been Gregory Hines, I can't remember now, had a hip replacement. And he was on television talking about that, and he was up there dancing again, and I know how it feels. I mean, once you love to move and then you can't, it's like getting a new lease on life. It's starting over. It's really, really exciting.
Experts say that moving, staying active, is an effective way to maintain joint and spine health.
The more active you are, within reason, the healthier your life is going to be, and the longer you may live, and the better shape you'll be going into old age, the better you'll weather that. Well, if you've got an arthritic joint, and that's the only thing keeping you from doing it, we now have technology, and it's exciting to be able to allow people to get back to more athletic activities where they can golf and swim and lift weights and take walks and be very, very active without pain.
If you'd like more information about any of the topics we've discussed tonight, including chronic pain management, complex spine, or joint replacement procedures, please visit our website at methodisthealth.com or call now at 713-790-3333. Make plans to attend a free Healthy Knowledge seminar. You'll have the opportunity to meet many of the doctors you've seen on tonight's show and find out if any of these procedures might help you. The free seminar is on Wednesday, June 13th at 5:30 p.m. Call us now to register at 713-790-3333. Thanks for staying with us tonight. Please join us again on the next edition of Leading Medicine. Good night, everybody.